and researchers interested in climate and health is they're very interested in inclusivity and fair adaptation. How to make sure adaptation protects the most kind of high risk communities. And this research project is a very good example of that. And not only is it sort of a good example of primary research, but also these principles have been developed to operationalise the research. So I'm going to hand over to Shapara, if you'd like to share your slides, and then they'll speak for about 20, 25 minutes, and then we have opportunities for questions after. Thank you.
So you can see my slide?
Yeah, could you put it in? That's it, great. Yeah, we can see it.
Okay. So hello everyone, I am Shapara Nawaz. Today, Dr. Jane Wilbur and I will be presenting and discussing the findings of our study titled Inclusive Pathways Towards Climate Resilient Wash in Bangladesh. But now I will just turn off my camera for a while during the presentation so that my internet connection remains stable. So why do we need to talk about disability inclusive wash more? WHO reported that 1.3 billion people in the world have significant disability, which means 1 in every 6 people have significant disability. And a large portion of them has invisible disability, like visual, hearing, or autism. Furthermore, a huge number of people with disabilities require support from caregivers to perform their daily activities, like eating, using toilet, or bathing. And nearly 80% of people with disabilities live in LMICs where access to wash services are limited, and often their accessibility issues are not considered in improving wash efforts. On average, people with disabilities are more likely to experience poor health due to their greater need but worse access to wash services. Children with disabilities under 5 are twice as likely to suffer from severe diarrhea. Additionally, people with disabilities have greater need for healthcare services. For example, specialized medical treatment, assistive device, but they face barriers in accessing these services. People with disabilities are also 50% more likely than those without disability to suffer from catastrophic health expenditures. All of these result in worse health outcomes and greater poverty for people with disabilities, and the expenditure can also make them multidimensionally poor. Now, why do we need evidence about disability inclusive climate resilient wash? Because people with disabilities face greater risk from climate hazards because of their existing vulnerabilities, such as limited participation in public life, that affecting their ability to express their washness and access critical safety information during climate events. And there is no rigorous evidence about the intersection between wash disability and climate change. Now, about our research study. This study was done very collaboratively through the partnership of London School of Hygiene and Tropical Medicine, ICDJRB, and World Vision. We had a multidisciplinary team, and the study duration was 2 years. The study was funded by DFED Australia through their Water for Women program. For those who doesn't know about ICDJRB here, I would like to provide a brief context. The full form of ICDJRB is International Center for Diarrheal Disease Research Bangladesh, and it is one of the world's leading global health research institutes. The research focus revolves around solving wash, maternal and child health, infectious disease, environmental health, issues in low research settings. ICDRB also provide healthcare services and humanitarian responses. And our widespread and effective partnership with global health organizations, government, and academia from global north and south support us to develop innovative public health solutions. Now, research aim. The aim of our study was to strengthen evidence about how climate hazards affect the health and well-being of people with disabilities through risks to wash and co-develop principles for climate resilience inclusive wash interventions in Bangladesh. Bangladesh is a country where different districts experience different climate hazards frequently. For example, Gaibandha and Shakira districts rank the highest in Bangladesh's multi-hazard risk level. Satkhira, a coastal district, is experiencing rising sea levels, salinization, river erosion, and cyclones. And Gaibandha, an inland district in the north, experiences frequent riverine and monsoon flooding. We started by conducting a scoping review to understand available evidence. We explored the climate risks to wash services and coping strategies applied by people with and without disabilities and assess effectiveness of climate resilient wash intervention. emphasizing their impact on people with disabilities in LMSs. We included 22 papers, both gray and peer-reviewed. Of these, only 2 evaluated climate-resilient wash intervention. Both covered rainwater harvesting and neither considered disability. Most papers examined people's self-reported health impacts and experience affected by drought-related water insecurity or wash infrastructure, damage due to their climate hazards. Data on the experiences of persons with disabilities were only included in 2 papers. This shows the absence of disability in this area of growing importance and attention. Without evidence about the experiences of people with disabilities and the coping strategies applied, developing disability-inclusive adaptation strategy will be very difficult. We work in Bangladesh because it's one of the most vulnerable countries to climate change due to its geographical location and dense population. And 50% of the total population live in the areas with high risk of climate change exposure. There is also a fairly strong policy context that consider disability, wash, and climate change. So what we did, we employed a mixed methods approach involving a quantitative nationwide population-based survey to identify people with disabilities and compare their access and experience of wash services affected by flooding and cyclone events. And we also conducted in-depth qualitative analysis of the wash experience of people with disabilities and their caregiver during and immediately after a cyclone and flood. For the quantitative component, we conducted a nationwide population-based survey on 32 selected districts on the country, which are marked in green in the map. We utilized a population-based survey conducted in 2023 that wanted to capture the wash experiences between individuals with and without disabilities, considering gender and age. It was funded by UK's FCDO and led by ICDRB. We added new questions to that existing survey questionnaire, focusing on the effect of climate hazards on access to and use of wash facilities. The districts were selected from 8 divisions using the probability proportion to size sampling technique to ensure nationwide representation. To identify people with disabilities, a household screening of individuals aged 15 years and above was carried out in selected households using the Washington Good Short Set questionnaire. For each participant with disability, one age-sex matched community control participant without disability was included in the study, so that the number of survey participants were 1,930, and we collected data from 1,021 people with disabilities and 909 people without disabilities. For the qualitative component, we conducted in-depth qualitative assessment in Satkhira and Gaibandha to explore rigorously how cyclone and flood affect the wash experiences of people with disabilities. We purposely selected individuals with disabilities from rural areas of Satkhira and Gaibandha, and some participants were selected through snowball sampling. 39 men and women with disabilities and 16 caregivers were included as study participants for qualitative assessment. Some were World Vision beneficiaries, but not all of them were World Vision beneficiaries. We conducted in-depth interviews, observation, and photo voice and ranking exercise with them. Well, we did not do a policy analysis because this was outside the boundaries of our study. So now I'll discuss a summary of our key findings. We asked our participants about the disaster preparation activities they undertook. They reported that no disaster preparedness activities related to water, sanitation, and hygiene was done by the community or at the household level. No one mentioned participating in clearing drains, emptying pit latrines, or doing any such activity. We also found that sanitation and hygiene was not prioritized in disaster preparation. Participants prioritized food and livelihood needs. But only a few families with a member with access issues or are entirely dependent on caregivers or have a member experiencing incontinence stored water at home. Regarding disaster relief and recovery, none of our participants from Satkhira reported receiving a wash or hygiene pack after the cyclone. However, a few participants from Gaibandha received soaps, menstrual materials, and water purification tablets. There were government-provided tubers, however, not many knew about any other long-term activities carried out by organizations which focused on making household wash services inclusive and climate resilient. Regarding water access, we found through the survey that 30% of the water facilities were damaged due to climate hazards. The deep tube wells, which functioned as household water collection points, were far away from the homes of the people with disabilities. Moreover, the tube wells were hard to use independently for them. The picture of the tube well on the slide shows a government-provided tube well in the Shatukira. However, there was no ramp or handrail at the water point to support people with disabilities in using it independently. The tube well is cyclone resilient and it has a very high brick and cement made platform, but it is inaccessible to people with disabilities. It will be difficult for them to climb the steps at usual times, let alone during a cyclone when the surroundings are waterlogged, muddy, or slippery. So what did they do? Many people with disability used their neighbors' tube wells and reported facing verbal abuse also. What was the sanitation experience of our participants during climate hazards? We found that traditional pit latrines were flooded and overflowed with waste. Half of the surveyed participants who had damaged toilets could not use the alternative toilets. Therefore, people with disabilities had to resort to open defecation, or they defecated in the floodwater. If we look at the photo in the slide, this was a self-directed photo of Mahidul Islam taken during the photo voice and ranking exercise to portray the challenges he experienced in using toilets during the flood. We can see that the toilet is in vulnerable condition without any strong superstructure or platform, and Mahidul said that it goes underwater during floods. Mahidul has mobility limitation, and he said he had to defecate in an open place or in the floodwater because of that. Some participants also reported continued use of damaged toilet, and some others who relied on using neighbors' toilets reported experiencing water abuse. We interviewed another man with multiple disabilities who preferred not to use the neighbor's toilet and continued the use of damaged toilet. When he tried to use the damaged toilet, feces contaminated water splashed back to his leg. He felt disgusted and did not always have enough water in sweat to clean. Because of experiencing these difficulties, participants limited their food and water intake so that they would not have to use the toilet frequently during cyclones and floods. We also interviewed people with disabilities experiencing incontinence. They shared the wash challenges they faced during climate hazards. People experiencing incontinence need a water supply, private sanitation facilities, and hygiene materials. This photo of Shikova Sarkar shows how difficult it was for her to manage the toileting of her daughter with multiple disabilities during the cycle. Her daughter experiences incontinence and relies on her for toileting. The spot in the photo is where she usually defecates. During the cyclone, Shikova could not reach the water point to collect the water and did not have enough water at home to clean wash. And she said, cleaning the pot that she defecates in was harder during cyclone upfront because we didn't have enough water to wash and clean. Regarding personal hygiene, people with disabilities also struggle to manage their personal hygiene due to cyclone and floods. In Gaibandha, participants could not reach the water points where they do laundry because the flooded surroundings. So they washed their clothes in floodwater. The floodwater was contaminated with feces due to open defecation and overflowing of toilets. And doing laundry in the floodwater increased the risk of contracting infectious diseases. Participants also reported bathing in floodwater in Gaibandha. The photo in this slide illustrates Morshada's difficulty in bathing. She owns the photo and gave us consent to use the photo. From the photo, we can see she takes bath in a pond in usual times. However, we see that path is not even and no secure handrail or any other supporting element was there to make bathing in the pond safe for her. Morshada moves with her hands through crawling motion, and we can only imagine how difficult it would be for her to reach the pond for bathing when the surroundings are waterlogged and the paths become muddy and slippery. Regarding menstrual health and hygiene, women with disabilities who were menstruating and used reusable menstrual materials such as menstrual clothes wash their menstrual clothes in floodwater in Gaibandha. As the floodwater is contaminated, it can increase the risk of having reproductive health issues for women with disabilities. Women with disabilities using commercial sanitary pads, and they threw away those pads in the floodwater. Disposing of sanitary pads in the floodwater can cause environmental degradation and increase the severity and frequency of flooding by blocking the drainage channels. These experiences demonstrate how people with disabilities struggle with personal hygiene management during climate hazards and emphasize the need for climate resilient and inclusive hygiene solutions. Here we are presenting some of the major impacts of the wash challenges mentioned before due to climate hazards. Many of the participants sustained physical injury while navigating through muddy, waterlogged paths and flooded surroundings while attempting to reach water points or toilets. This was a common impact found across both districts. This is more serious for people with disabilities as injuries can make their disability worse. They are also more vulnerable to slipping and falling due to their functional limitation. So what happens when they get injured? Their dependency on a caregiver increases. Consequently, their caregivers' wash-related tasks increase in that emergency. We remember talking to a man with mobility limitation in Shakira. He had one leg and he fell and got injured while going to the toilet during the cyclone. After getting injured, he could no longer use the toilet independently. He had to stay in bed, defecate in a bucket, and had to rely on his wife to clean it. This indicated how those injuries worsen the health condition of people with disabilities and increase reliance on caregivers. Participants also reported coming into contact with urine and feces, which increased their risk of contracting infectious diseases. If you look at the photo of Ajiran Begum here in the slide, we can see she has mobility limitation and difficulty in walking. She uses a stick to walk when toilets get flooded, and if she tries to use the toilet then, there is a high possibility that she will come into contact with urine and feces. She says, my legs gets dirty while using the toilet. Immediately after the cyclone or flood, some households tried to fix their latrine with locally available cheaper materials like bamboo or sand because they did not want to defecate in the open anymore or didn't want to depend on their neighbors. However, those fixed or rebuilt latrines were not made accessible for household members with a disability. Climate resilient latrines are expensive to build for families with limited income and they must use all their assets if they attempt to do so. Moreover, making the sanitation facilities both accessible and climate resilient will cost them more. Each disaster adversely impacts their lives and damages their existing wash facilities and livelihood, and they become poorer and more vulnerable with each disaster. This likely has a more significant impact on households, including people with disabilities, due to extra cost of disability-related care or higher catastrophic healthcare costs. Because of this, they may be more financially vulnerable than others and have to bear equal or higher costs related to making wash services climate resilient. To summarize, people with and without disability face similar risks due to climate hazards like cyclone and flood. However, people with disabilities have more adverse health outcome and they have additional wash requirements depending on the type of disability. For example, the risk of them of sustaining injuries while accessing and using wash facilities and contracting infectious diseases due to coming into contact with urine and feces increases due to this climate hazards. Additionally, those people with disabilities experiencing incontinence and women with disabilities who are menstruating then also have additional wash needs, which became very difficult to meet during and immediately after those climate hazards. And when these needs are not met, the whole family's health and well-being are put at risk. Families with people with disabilities may be poorer to begin with and can become more impoverished while trying to repair or rebuild their damaged wash facilities or coping with disaster wash services after climate hazards. Now I will hand over to Jane to continue our presentation.
Thank you, Shapra. So what we did after we'd collected and gathered all the data was we held meetings, participatory meetings, with people with disabilities and their caregivers who were part of the qualitative assessment. We also invited organisations of persons with disabilities and World Vision field staff to this meeting. We held one in each district, so one in Shakira, one in Gaibanda. And it was to share the research findings back to the participants. So to see if we were on the right track, had we missed anything? Is our analysis correct? So really to validate the research findings, which was done. And then we asked the participants to come up with their own recommendations. So we explained that we were going to develop these principles for climate resilient, disability inclusive wash. And we wanted to hear from them what they wanted included within those principles and suggested activities. We were really surprised with the engagement of people, very pleasantly surprised. People were very supportive of each other. one woman, when we showed her, so she was a mother of a woman with an intellectual disability, and we showed her visuals of how she could make her existing latrine more climate resilient and accessible through visual pictures and simple information. And she said, give us more of this information. We need this information. Help us help our children. So there was very much a demand for it. And then after that workshop, we held another workshop in Dhaka where we invited sector experts to join. They were from health, climate change, WASH, humanitarian, and they reviewed the principles that we had developed and drafted. And these principles were based on different existing frameworks for climate resilience and disability inclusion. So they reviewed them, and then they came up with their own suggested activities to meet these key principles. The suggested activities incorporated the recommendations that were made by the participants from our study. Next slide, please. So I'm going to give an overview, a very brief overview of what the principles are and how they can be used, who they're for, and how they can be enhanced. Thank you. Next slide, please. So we have 6 principles that promote the meaningful inclusion of people with disabilities and their caregivers in climate resilient WASH interventions. Now, each 6 principle include suggested activities to help meet those principles. They're directed to practitioners working in WASH, disability and climate change. Next slide, please. And they are really to strengthen disability inclusion in existing climate resilient WASH efforts by incorporating these suggested activities. So it's not about how to do climate resilient WASH interventions, it's about how to improve what's there already to make sure that people with disabilities are not excluded. The activities are not prescriptive, so there's a list of them, but practitioners can select those that are most relevant for their context and their intervention, and they may also add new activities if needed. The principles should be used alongside other guidance for climate resilient WASH that are evolving and emerging at the moment. Next slide, please. So now I'm just going to go through the 6 principles, and I'm going to give an example of one suggested activity. And at the end, I'll share the QR code so you can see the report and the principles and all the activities. But the first one, so all these principles are based on human rights. The first one is around accessible infrastructure and information. So climate resilient WASH services and information are accessible to all people with disabilities before, during and after climatic events. Now, all people within that is important because in the activities, we specify specific activities for different impairment groups. The first suggested activity is to engage people with disabilities and their caregivers in climate risk assessments to understand their WASH experiences and behaviours before, during and after climate events. And also to ensure that data collection is gathered or data is collected across people with and without disabilities, across impairment groups, ages and genders. The second one, this is around supporting caregivers to help them provide hygienic care to people with disabilities. So the principle is caregivers can safely deliver hygienic care to people with disabilities before, during and after climatic events. Now this is around a suggested activity, 2.3 is around distributing commodes with lids, bedpans, urinals, incontinence products, gloves and brushes for cleaning those products, along with information about how to use the products safely, how to clean them, and how to dispose of human waste hygienically and in an environmental friendly way. Next slide, please. The third one is all around do no harm. So people with disabilities do not face harm when accessing climate resilient wash services before, during and after climatic events. So that is around including getting to disaster shelters, accessing services when they're there, but also and when they return home. And a suggested activity is around raising awareness about how climate-related disasters heighten risk of abuse, accidents and discrimination against people with disabilities. So that's all around raising awareness of the risks. There are also suggested activities about how to manage those risks in participation with people with disabilities. The fourth is around affordability. So climate resilient wash services are affordable for all people with disabilities. And this is around strengthening the workforce to support people with disabilities in WASH by partnering with organisations of persons with disabilities, disability service providers, and organisations focused on livelihood and sustainable agriculture activities, so that people can generate an income through livelihoods or agriculture, which would support them to be able to financially adapt their wash services to be more climate resilient and inclusive. Next slide, please. This one is all around meaningful participation. So this is absolutely core to human rights. So effective mechanisms exist to assure the right of people with disabilities to actively and meaningfully participate in developing climate resilient wash solutions. And a suggested activity is to support people with disabilities in participating in climate resilient wash, disaster preparedness and management activities at the household and community level. And again, there are a lot of other suggested activities that can build on that. Next slide, please. The final one is around enhancing capacity, awareness and skills. So this is the sixth principle is government officials and service providers address the requirements of people with disabilities and their caregivers when providing wash services that are resilient to climate change impacts. This is so the suggested activity is around investing in awareness raising and skill development on climate resilience, disability inclusive wash for government officials and practitioners working across health, agriculture, education and wash sectors. Importantly, these awareness activities should be led by people with disabilities. So organisations of persons with disabilities or disability service providers to help really raise awareness. Next slide, please. Now, we've written a very, very short report on the study, on how we develop the principles in a participatory way, and then the actual principles and suggested activities. So that is the QR code on the slide, and we will pop the link in the chat as well. Next slide, please. After we did all this, World Vision Bangladesh, who is a key partner and collaborator on this project, then took the principles and worked out how they could integrate them into their existing climate resilient wash programs in Gaibandha and Shatkhira, so the two districts that we did that in-depth qualitative assessment in. And there were two intervention design workshops. And the process was that they reviewed the suggested activities in the principles against their current programme plans and activities, and where there were any gaps, so where the principles and activities suggested new things that they could integrate, they added those to their existing implementation plans and agreed actions and timings for that. Next slide, please. And just some references for the presentation. Next slide, please. And finally, this is the research team. Thank you so much for inviting us to present on this webinar. We really appreciate it, and I hope you found our presentation interesting. We're very much looking forward to any questions or comments you have. Thank you.
Thank you so much, Shapira and Jane. We have, it'd be great to have some more questions in the Q&A. That was great. That was really clear. Okay, they will arrive. So the first question is around what are the interventions to combat the situation? So is it possible to answer that? I assume it refers to climate, the evidence base around climate resilient wash, which, Jane, do you just want to comment on the review that was done?
Yes, so Shapra spoke initially about the systematic review that we did. And I just want to also say Shari was part of this study as well. So the systematic review, we only found 2 interventions across all the screening that we did that explored climate resilient wash. And that they both focused on rainwater harvesting. They were very much focused on the technical design. They didn't explore maintenance, operation and maintenance of the facility. So they didn't look at sustainability and water quality. Neither did they consider disability. So there's very few examples. And I know this program was funded by the Water for Women Fund. That program was running for 2 years, and it funded a number of organisations to deliver climate resilient wash, inclusive wash interventions. So there are interventions out there, but they haven't been evaluated. And that's a really important point, that we need to build the evidence, the rigorous evidence about what works, and then what the outcomes are for the different groups. And then we can say to governments or investors, this is what should be scaled up.
Great. Thank you. Next question was about the study design. So for Shapara, what was the basis of selecting the 32 districts for the study?
So Bangladesh have 8 divisions and evidence and reports. They all mentioned that the whole country is more or less vulnerable to climate hazards like cyclone, flood. So in total, 32 districts were selected from 8 divisions using the probability proportion to size sampling technique to ensure the nationwide representations. And then those districts were further divided into the country's smallest administrative units. And from each selected district, we selected the 3 rural administrative units and 2 urban administrative units, considering the same previous sample. And each, we found 162 smallest administrative areas in total, and those were divided into clusters of 30 households, and randomly 1 cluster was selected for household school units. And if further details are needed for the sampling technique, you can always give us a mail and we can share with the details.
Great. Thank you. And then there's another question for you about the ethics review. So did the study protocols, what ethics review did they go to? And highlighting the importance of ethics. So if you could just describe that. Thank you.
Yes. We received ethical approval from London School of Hygiene and Hygiene Tropical Medicine and ICT Board. So we submitted our research review protocol and ethical review protocol to the Institutional Review Board and Ethical Review Committee of ICT. They went through it rigorously. We also submitted the guidelines we followed and the survey questionnaires and how we will approach to the people with disabilities, how we will ensure their confidentiality and privacy. And then after ensuring that we are following the rigorous guidelines established by the standards of ethical review committee of LHSTM and STDIP, we got the ethical review approval to conduct the study with people with disabilities. And also the research team members were trained on how to approach people with disabilities and do ethical research with them.
Can I just add a point? Just to add on from Chapra's point, which were, really comprehensive. But we also, whenever we do research with people with disabilities, we make sure that we have simplified informed consent sheets. For example, we allow sign language interpretation if required. So we make sure that people fully understand what they're committing to before they enroll in their study. And something else that's really important, because violence is quite prevalent, particularly for people with disabilities and especially for women with disabilities and those with intellectual disabilities. Whenever I do research, I always make sure that we have a referral matrix for any disclosures of violence. So that takes the research team through steps. If anyone says they have been exposed to violence, and then that's categorized by age and violence type, these are the steps that you must take. And then it accumulates in linking up with the services that World Vision can provide. But it's very, very important to be incredibly careful when you're working with this group.
Yeah, there's a follow-up question from Alice about what was the nature of the abuse that was found, because Shapiro reported these findings of abuse, and it's clearly a key issue. I don't know if you just want to add a comment about that.
The participant reported that it was verbal abuse. We remember talking to a person with mobility limitation in Gaibandha when he wanted to use his neighbor's toilet during the flooding. He said that I could not tell you in bad words. I could not explain the bad words they used for me when I went there to use their toilet. So it was verbal abuse. No one reported any physical abuse, but most of them reported that they were verbally abused. Neighbors prohibited them, or when they saw them that they are using their toilet facilities continuously in this emergency situation, then they started rebuking them, scolding them, and verbally abuse.
Great, thanks. Sorry, we've got a lot of questions coming now, so I'm just having a quick. There's a couple of questions about gender. What findings there were in terms of differences in climate resilient wash by gender and the intersectionality between disability and gender. And also a question around whether you interviewed any pregnant women and some of the issues around that. So, Shapira, do you just want to, or Jane, just relate the findings in relation to gender and the implications? Thanks.
Start and then Jane can add. I will. We didn't have any pregnant participant in our study, but yes, we did. When we discussed about menstrual health and hygiene, women with disabilities who were menstruating during the cycle or flooding, they mentioned how difficult it was for manage their menstrual health and hygiene during these events, and they mentioned how difficult it was to reach the water source and get cleaned because they need access to private wash facilities at that time, and they didn't have enough water, and they had to keep the used menstrual materials inside their home because they could not dispose it properly. And also, women with disabilities reported privacy issues more when they were talking about resorting to identification. Jane can add.
I think you've covered all of it. The only other one was that all caregivers we spoke to were women. So that it was a gendered issue. Caregiving was a gendered issue in this setting. And often, actually, something we see across several different research studies that look at caregiving and disability and WASH in different settings are that it's very, very difficult. Often women are lifting people without any lifting device. Their children grow, they get heavier. So women particularly experience a lot of physical pain because they don't have the assistive devices to be able to provide that personal hygiene care and sanitation safely for themselves as well as the other person.
Thanks. Okay, so we have a question about, which is not quite the focus of the study, is about working with people with disabilities during a climate event or a climate disaster. Perhaps Jane, you could just comment on that. So do the principles as well also, how do they relate to some of the more operational injuries, in an emergency, I guess?
Yeah, thank you. So we wanted to make sure that the activities did. So in our principles, we talk about before, during, and after climatic events. So there are suggestions in there about the inclusion of people with disabilities in disaster risk reduction.
Great, thanks. I'm just looking at questions. So there's a question about, it would be interesting to explore the prevalence of waterborne diseases during these events. And, I mean, I can answer that. There's very little kind of primary research. So it's absolutely a crucial problem, but there's very little that's done because of the sense that of what kind of health data is available and what epidemiological studies could be done. So, there's obviously an increased risk in outbreaks following a disaster. But I think the issue here is that the health surveillance should be able to take account people with disabilities so that you have reported, health outcomes that are disaggregated by disability, and then you could see what the differential impact was. So that was, that's an issue for kind of health information systems, which is also kind of one of the findings of the project.
Shari?
Yeah.
Sorry, do you mind if there's a question about what about how can the principles be applied to other settings like dry, dusty, hot? Is it okay if I answer that one?
Yes, please do.
So I think this is a really great question, because these principles have been designed for flood and climate areas, or areas that experience that. What now needs to happen is that we need to explore what the issues are for WASH and the experiences of WASH and disability and climate risk in terms of areas that have reduced rainfall and drought. Because, for example, something like menstrual health and managing that becomes incredibly difficult if there's no water. So the issues, we would really like to explore what the issues are, and then use the same research design to take the principles and adapt them for these different settings. And that's something that's a real priority that we would like to do in the near future.
Okay, there's a question from Gift about the definition of disability that was used, given that 1 in 6 people are disabled. Was the project focused more around kind of mobility limitations? So there's a kind of broader question, how do you define disability? But did perhaps just revise which disability groups you looked at? It's the last question on there.
Okay, shall I start, Shafra? Okay, so we applied the Convention on the Rights of Persons with Disability definition of disability. And that's where it's around how participation can be impacted by impairment, and it's across all different impairment groups. So what we used was the Washington Group short set of questions, which is a really, really excellent tool that's been piloted and used in surveys in globally. So those questions explore if the participant, and you have to ask the person directly, not through anyone else, if they experience any functional limitations, so difficulties functioning across 6 domains. So that's hearing, visual, remembering and concentrating, self-care, and communication. So you ask the participant, do you experience for example, any difficulties hearing, even if you're using a hearing aid? And the answer is no difficulty, some difficulty, a lot of difficulty, and cannot do at all. So we identified people with disabilities who experienced a lot of difficulty or cannot do at all. So it meant that we were able to look and engage people from across all the impairment groups. So it was cognition, visual, hearing, mobility, self-care, and communication.
Thanks. Okay, we've got 2 final questions. So for Shapira, could you just make some comments about the challenges of persons without disabilities during these climate events?
To kind of also experience similar challenges, like people without disabilities who were involved in the study as comparison group. They also reported their damage of wash facilities, the damage of toilet, the damage of water points, but they reported less about their difficulty in accessing the toilets or accessing the water points. They said it was difficult to navigate through the flood water, or maybe it was difficult for them to reach the water point, but it was not at that much intensive for them compared to people with disabilities.
Great. Thanks. Someone's got their hand up, but just one quick final question about this finding indicate that there's no option but to empty pit latrines before a flood. But this kind of goes into the territory of what, the technical design around latrines and things. So Shapira, I don't know if you want to answer that.
I can answer this question from the social context. The qualitative impact assessment we did in rural areas, and the structures are not really that much strong or that much well built to, or even to the families that have the traditional pit latrines. They don't have the financial means to clean the pit latrines before flood or during a disaster. Even sometimes they don't even get the forecast or warning for that there will be flood. So they don't have that financial option, or they don't have access to that information to clean their pit latrine before the flood. Yeah.
Right, thanks. Okay, that's the end of the questions. We have a tiny bit of time left. So I wondered if anybody has any further questions, or if anyone has any questions about the Chance Network. So I wonder if Gloria and Vincent could put their cameras on as well, if they're still here.
I'm here.
Yes, well, thanks so much, Jane and Shapira. That was great, and a lot of really useful questions as well. And we have another webinar lined up in April. Caroline, I don't know if the date's been confirmed yet, but that will be with the Rockefeller Foundation, some researchers presenting their work on climate finance, climate and health funding, which I know is of interest to many people in the network. So Gloria and Vincent, do you want to say some final words before we close the session?
Vincent, please go ahead.
Oh yeah, in the interest of time, I think I can give that to you, Gloria. Yeah.
Okay, perhaps let me just go ahead then. Thank you, Vincent. I just want to thank the 2 speakers. This is such an interesting talk. And, as I was listening to you around WASH and your focus on people with disabilities, I thought, wow, this is, I don't know about others, but this is the first study for me that focuses on people living with disabilities, and thinking about how to then accommodate them, what are the adaptation activities that we need to be thinking about for them as well. So thank you, because this is much information, evidence that we need generated. And I hear that there's a couple of papers that are under review that are focusing on this. So well done, and we really thank you for sharing that. This is very unique and something that is extremely needed. So on behalf of the Chance team and the Chance members, thank you for your time and thank you for sharing this information with us. And we will be putting your slides on the website. I think Sarah mentioned that on the website for all the other members who would like to access the slides. And then on behalf of the Chance Network, the steering committee, so thank you, Shari. Thank you for chairing this session, which was done extremely well. Thank you, Caroline. Thank you, Vincent, and the rest of the team. For coordinating this webinar. As I mentioned earlier on, that we will be having these bi-monthly webinars. So Chance members, please be on the lookout for these webinars. I know some of the members are new. We've been going around, and after Chuck, we had new members. So welcome, and be on the lookout for these webinars as they come up. Should you have also topics that also, suggestions for us, please also reach out and say if there's an interesting paper that you are busy with or study, let us know. Or if there are any other case studies or best practices that you would like to share on this platform, please feel free to do the same. We do have, I think, Caroline, if you can just flash a QR code. People have been asking, how do we join the Chance Network? There is a QR code that we can flash, and if you scan that, then you'll get more information. There it is on your screen. Please join the network. That's where you get a lot of information around climate change and health in the African region. We also have a website that you can access. We've got Caroline, just share your contact details as well. In terms of email, if people are not able to get through the QR scanner, they can email directly and ask to join, to be a part of the network. And lastly, from me, we have the conference coming up. We look forward to hosting you in Nairobi in September. Thank you very much and have a wonderful day. Back to you, Chair.
No, thanks so much, Gloria. So thanks, everyone. I'll close the conference, well, the webinar then, and I wish everyone the best for the rest of their day. Thank you.
Thank you.
Hey, everyone.
Bye.
Bye.
Bye.